Hi everyone, I'm Jiayi, and this is my patient Han and photographer Sophia, and I'm going to begin the head to 360 view. Now I'm going to begin the head to toe assessment. Going to apply hand hedging, some gloves. And using the wrap to wrap the stethoscope. I'm Jai, I'm the student nurse here today. Today I'm going to perform head to toe assessment for you. Is that okay? Just for checking your overall health status, do you have any pain? And do you need to go to washroom? And close the curtain for privacy. Can you tell me your name and date of birth?
My name is
Maybe
Will
the
Overton,
band.
and date of birth is 1933, August 26.
Yes, and could you please stand up for me? And the color of the skin color of the patient is consistent for his genetic background, and the age is look like his stated age. The head is within the head of the patient is within the normal range, and no abnormal physical deformity. It's symmetric. Could you please sit down? And the patient looks like he having a good mood. He smile and calm, and he remains a good personal hygiene. He sits up straight, no leaning around, no swinging or leaning side to side, and could you breathe for me? Workout breathing is relaxed, calm, effortlessly, and no sign of distress. He dressed properly to the weather outside, and he having eye contact with me. Yeah, and could you please tell me where you are?
We are in the hospital.
What's your name?
My name is Will Overton.
What time is it?
It's around 3 in the afternoon in April 1st.
Yes, and my patient is alert, awake, and he's oriented to time, place, and person. I'm going to inspect the face first. The face is the skin color is consistent with his genetic background, and is symmetric. No involuntary movement, no masses, no lesion, no scars. And could you please lift up? Could you please show your teeth, smile, and puff out your cheek? When I apply to resistance, could you please open it as much as possible? It's great. This test, I'm testing for cranial nerve number 7, is the facial nerve, which is the facial nerve. He's being able to do all the movements symmetrically, and the cranial nerve number 7 is intact. And then I'm going to check the eyes. I'm going to inspect you first. The eyebrow is symmetric. The eyelid skin is intact. The color is consistent with his genetic background. The eyelashes are evenly distributed. The sclera is white with tiny pink blood vessels uncovering, and the conjunctiva is pink. No lid lock, no discharge at both sides, no crusting. And I'm gonna check your pupil side. The pupil, could you please look straight? The pupil side is 3. The pupil side is also 3 on this side, and those side is equilateral. It's equilateral. Going to test for the light reflex, direct light reflex. When I shine the light to her left eye, the left pupil comes straight. When I shine the light to her right eye, the right pupil comes straight. And this is going to perform the concentric light reflex. When I shine the light to her left eye, the right pupil comes straight. When I shine the light to her right eye, the left pupil right at the left pupil constraint. Can you please stare at the tip open when I'm moving closer to you? The patient's pupil converge and converge while I'm moving the pencil towards him, closer to him. And this is a accommodation. The patient cranial nerve number 3 oculomotor nerve is intact. Now I'm going to inspect the nose. The nose is in the midline, it's symmetric, no discharge. The ears is skin is intact, is equal, the size is equal bilateral, no discharge on both sides, no cerumen on both sides. I'm going to inspect the mouth. The mouth is, the lip is pink, hydrated, no lesion, no masses, and the color is consistent with the genetic background. I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve, and number 10 is the vagus nerve. Could you please say ah? The patient's soft highlight and the uvula are rising, which means the cranial nerve number 8 and 9 and 10 are intact. And could you please repeat after me, saying night light dynamic?
Light, tight, dynamic.
Could you please show your tongue? And the tongue is at the midline and move it side by side. And the patient be able to perform the test. And the cranial nerve number 12 is intact. The hypoglossal is intact. And patient repeat the 3 words without tremors. I'm going to inspecting the neck. Could you please look upwards? The color of the neck is consistent with his genetic background. No involuntary movement, no scar, no lesion, no masses, and also is symmetric. I'm going to palpate. No mass, no palpable masses. The trachea is at the midline, and no enlargement of the thyroid gland. Do you feel pain?
No.
No pain, no tenderness, and no swelling, no inflammation. And going to check for the carotid pulse. After 30 seconds, the rate is 80 beats per minute. The rhythm is regular. The bonding strength is 2+. Same to this side. After 30 seconds, the bonding strength is 2+. The rhythm is regular. The rate is 80 beats per minute. It's equal bilateral. And going to test for the cranial nerve number 11. Place against my resistance. Shrug your shoulder, face, rotate your head, and the patient is be able to perform those. The cranial nerve number 11 is intact. The spinal accessory is intact. Now I'm going to inspecting the upper extremity. And the patient, the color of the upper extremities is consistent with his genetic background. No masses, no visible masses, no involuntary movement, no asymmetric, no lesion, and there's a scar at his left forearm. No masses, and Going to palpate it. Do you feel any pain?
No.
No pain, no tenderness. The temperature is warm, it's moist, the skin is firm, and no swelling, no edema. I'm going to test for your radial pulse. After 30 seconds, the radial pulse strength is 2+, it's bonding, the rhythm is regular, and the rate is 80 beats per minute. The left side, I'm going to palpate the right side. After 30 seconds, the rate is 80 beats per minute, the rhythm is regular, the grid strength is 2+. I'm going to test for equality. It's equal bilateral, it's symmetric. And could you please hold my finger to test the grip strength? The patient can grip my finger really strong, really forceful. It's symmetric. The strength is symmetric bilateral. Going to check your lower extremity. I'm going to inspect you first. The color of the lower extremity is consistent with his genetic background. No masses, no lump, no lesion, no involuntary movement. It's symmetric, and no scars. Going to palpate it. Do you feel any pain while palpating?
No.
No pain, no tenderness, no joint inflammation, no masses, and the temperature is warm to touch, and the skin texture is firm, and it's moist. Yep. Could you please turn around? I'm going to inspecting your posterior thorax. And her posterior thorax is the color is consistent with her genetic background, and the color is consistent with her genetic background. No masses, it's symmetric. No masses, no lesion, no scars. There's some moles here. There's some darkness here, and it's symmetric. No involuntary movement. I'm going to palpating. Could you please tell me if you have pain? No pain?
No.
No pain, no tenderness, no masses, and no inflammation, no edema, and the temperature is warm, the skin texture is firm, and it's moist. I'm going to check your chest expansion. Please take a deep breath for me. The patient chest expansion is symmetrically, and while I move my finger while she's breathing, my fingers move in and out while she's breathing. I'm going to auscultate. Could you breathe for me? Can you breathe for me? While I was quotating, there's no abnormal sound, like no abnormal, and no wheezing or crackle sound, and the breathing sound is equal bilateral on both sides. And could you please turn around? I'm going to count your respiratory rate. After 30 seconds, his respiratory rate is 17 breaths per minute, and the quality is unlabored, relaxed, calm, and effortlessly, and the rhythm is regular. I'm going to auscultate your apical heart rate, and apical heart rate is located at the ventral valve, is at the left mid-clavicular line at the fifth intercostal space. I'm going to use the diaphragm to auscultate the heart rate first. After 30 seconds, the heart rate is 80 beats per minute, and the S1 and S2 is audible, and no actual murmur or burst sound. I'm going to use the bell to auscultate actual heartbeat. No actual audible heart rate such as S3, S4 heard it. And could you please take a seat? I'm going to check your abdominal. We'll use the grip to cover the patient. I'm going to inspecting the abdominal first. The umbilicus is at the midline, the contour is flat and no scar, no lesion, no masses. The color is consistent with patient's genetic background, and no, it's symmetric. I'm going to auscultate. We start from the lower right interquadrant. Upper right quadrant. Upper left quadrant. Lower right quadrant. Lower left quadrant. The high-pitched gurgling sound is audible in all four quadrants, and is like two sounds per 5 seconds. 2 sounds are per 5 seconds. I'm going to palpating your abdominal. Do you have pain? No pain. Do you have pain?
No.
Do you have pain?
No.
No tenderness, no pain, and no superficial masses, and that's it. That's all done. This is my head to toe assessment.